The Foundation for International Medical Relief of Children seeks to provide access to medical care to people around the world. We do that through focusing on health education and working alongside community members.
The Philippine healthcare system is decentralized. The different local government units, so the governor, the mayor, the village captains, they are the health managers. So that's why it's very important to work with local officials.
Our main campaign right now is PhilPen. PhilPen stands for the Philippine Package of Essential Non-Communicable Disease Interventions.
In 2013, Cavite told UP that they want our assistance in the issue of non-communicable diseases. And when FIMRC came in, that was our expressed partnership point for FIMRC.
We go house to house screening community members on the risk of developing a cardiovascular event in the next 10 years.
Ask if they've been smoking, if they take alcohol, if they had a heart attack, if they had a stroke. And then we'll do the basic vital signs.
The house-to-house visits are politely intrusive. It kind of seems like the barangay health workers knew their whole community. So it didn't feel like a stranger was going into the other person's house.
We were actually really well received. So for instance, at one house, it was one older woman that agreed to have her blood pressure taken. By the end of the visit, she had pulled most of the family members that were home to get assessed as well.
Once we finish their screening, we are able to stratify them, develop interventions, and refer community members to the rural health unit as necessary.
No matter how basic everything is, the people are able to get that consultation at least.
The different villages, aside from doing the screening, are also starting to do things that can be done to control hypertension, to control diabetes. And one of the principles is actually sustainability through mobilization and education.
We were tasked to put this PowerPoint together, and then one of the midwives presented it. So going forward, she's going to use the slides that we prepared, and she's going to present this PowerPoint in other areas.
I think where I made the biggest impact here was with line dancing. Just seeing they're senior citizens, so they don't really work out like young people do, so line dancing is good for them. Once they finally mastered the steps of the line dance and how happy they got, it was really nice that I actually showed them something that they could use as some form of exercise.
Our newest partner is the Volunteer Services Center of UP Manila. We were doing arts and crafts with patients with cancer.
The woman I was helping in particular, we were almost at the end of her first rosary that we were making, and then the beads fell on the floor, and essentially we had to start over. So we took a break, and then we came back after lunch, and she really wanted to finish this rosary still. You know, as a cancer patient, she had this resilience. As a volunteer, that was a really rewarding experience.
I hope the volunteers appreciate the culture of the Philippines, how resourceful they are.
The university and FIMRC are working with Cavite to try and help Cavite empower itself. And we just help provide a nurturing environment towards their self-empowerment.
Every time I come back to the Philippines, it's a special trip. This one in particular, because we were exposed to people that really don't have access to health care. And that really was just eye-opening, and you are thankful for what you do have, and makes you just want to give back to the community even more.